Hi, my name is Wendy Prosser. I work with Layla at JSI. I've been working specifically with immunization supply chain for about 10 years, really in the nuts and bolts of getting vaccines from one place to another with in low and middle income countries. So I'm piggybacking on her to give kind of like the softer side of how we started this forecasting initiative and lessons learned along the way, which have been a ton and some great questions already. So just an overview of our approach and our project in general. As Layla already mentioned, that the COVID collaborative supply planning approach to everything. Our mission is to work with governments and with partners to strengthen the collaboratively supply planning approach, the forecasting, the analytics that go behind it, the involvement of people looking at data, using that for evidence for forecasting. The goals is, as you can see, is to enhance the operational decisions that countries need to be making for the COVID vaccine, and with the longer term goal of incorporating this into routine vaccines as well. Strengthening the country capacity for supply planning and improving data visibility and use, which we've already touched on. And then finally, supporting the government leadership and really making good decisions based on evidence, and especially related to the COVID vaccine as they're getting delivered and when and how much and how best to operationalize that. So a few of the key elements that we have is the use of historic periodic consumption data versus coverage, and Layla talked to that a bit, that there was no coverage data, there was no forecasting, there was no demand known for the COVID vaccine as it was getting rolled out. The other element is to be able to consolidate data in a way that helps countries make these timely operational decisions. The project works closely with the national logistics working groups, and all countries have this NLWG that's specifically for vaccines and planning out all the normal baby vaccines. And these have been switched in the past year, of course, to focus on COVID and how to roll that out. And then a key part of this is standardizing this approach across all countries and standardizing the tools, standardizing the analytics to have a larger global view of what's happening with the COVID vaccine. Another key element is this whoa.
Yeah, sorry for the interruption. Could you please share the screen?
Maybe he's that inspired by the talk.
I think the person realized maybe.
Ah, thank you.
Right. Sorry. That's was it this one here?
Thank you.
Right.
Great. Thank you for pointing that out, whoever that was. The final element that we're looking at is this adaptive learning approach, where we are looking at what's happening, what's failing, what's a success, how to reinforce that, how to adapt along the way, adjust to really how to strengthen most the approach for COVID vaccine supply planning. So the lessons that we've learned along the way. The challenges, I think probably everyone is aware of these challenges, the data availability, the accuracy of the data, the quality of it, getting the right data at the right time. The great question of like, do you have facility-based data? Do you get it timely? It's a really questionable thing. The annual vaccine forecasting approach that has been used for vaccines like Layla was talking about doesn't really adapt well for the COVID and this emergency situation, essentially, where we don't know what the demand is, and the demand is shifting dramatically, constantly, the supply is shifting. And so that what EPI managers have known and vaccine managers have known how to do isn't applicable in this particular situation. Additionally, the skills for the analysis and the decision-making, again, it's a new situation, it's a new learning approach, and the skills just have not been built up for this. And then finally, there's global reporting mechanisms. Different data is going to different organizations for different reporting, and that complicates a global view of what's happening with the supply. So what this initiative and this forecasting initiative has done, a few different things. One is this created a structured tool to standardize the data that's coming from all the different countries. And this is standardizing the products, it's the naming structures, it's using the same vaccine names and the characteristics to really set up this standardized approach across all countries. So then we can have a global view of what's happening with the supply and demand. Some countries, back to getting the data, they created some of these stopgap measures to address existing data challenges. For example, some countries had literally had people call in during these big campaigns every day. We vaccinated this number of people in this district in this day, every single day, which is great, does then complicate the regular systematizing of data collection, but it was this stopgap measure because they understood the need for getting data of what's happening on a daily basis. We also established this process of review and analysis with a focus on the ability to adjust supply plans based on what's happening in the reality on the ground. Layla gave a great example in Niger that they're normal, they could get like 20,000 people a month, and then they had a big campaign, and the maximum number of people they could reach during that campaign is 400,000. That then got factored into their supply planning. And other countries have started recognizing that they have reached a high coverage rate, Mozambique, for example, and they don't need all the vaccines that the COVAX facility was offering. So it's this learning as you go and starting to look at the data in a different way that then will lead to better decisions. And then finally, this vaccine stock summary report. Again, it's this practical application of the data that's available that then leads to decisions for supply managers to know what's happening in the field. The other part is the ownership and governance and the policies. And this is really like the softer touch of things, but super, super important. One of the biggest challenges is the coverage. Like they're always looking at coverage, 80% coverage. We want to reach 85% coverage, but that doesn't necessarily match the reality on the ground of what the demand is or what even the supply was at the beginning. And then matching that with what a country could handle just in terms of the logistics and the supply chain management of things. The political influences are real and they're often very painful. Countries will donate vaccines, and so it's a political decision. They don't necessarily talk to the EPI manager or the vaccine logistics guy about this. They just show up. Even if it's needed, if they have the cold chain space, it's the politics are real and they're very influential in this situation. With the data sharing, ministries are often very hesitant to share data because of the optics. In a case of a country that has to destroy a couple million doses of the vaccines because they've expired, that has really negative repercussions in the media, in the social media, because Malawi is a great example where vaccines expired, they destroy them, woohoo, that then became, oh, the vaccines are not good, they're not safe for me. And this is how, like the social media, we know what happens there. Then the other part with the ministry is that ownership or power to change the supply. And Layla mentioned this a bit, like there was a lot of allocations and here are your vaccines, take them, and ministries often didn't have the power to say no. With this approach, we've started having better visibility into supply decisions. So they're creating more ownership and better decisions based on evidence through this. We've been doing a lot of working closely with ministries and partners to build the capacity to use this data, to look at it in a different way. And then with the longer term goal of incorporating it into regular processes. There's a data use policy that's been drafted to really clarify who owns the data, who gets to share it, it's ministry data, how do they share it outside to external partners. With the government adoption of this approach, there's been more concrete evidence of monitoring the supply, monitoring the demand, and being able to make these decisions. And finally, we've started seeing with these 16 countries where we're doing this, that's kind of a proof of concept, and that's coming up to the global level, and there's more support and reinforcement of this approach at the global level that then is reinforcing back to the countries. So it's evidence, it's using this initiative and a forecasting approach with data that may be of decent quality, maybe not, but at least it's that the initiative and the way of looking at the data that's then re-strengthening this overall initiative. So where is this going? Longer term, the view of this could be this VAN, a Visibility and Analytics Network. That's a private sector approach. I'm sure you've heard of it. It stands up this end-to-end visibility that then leads to the analysis and insight, the continuous improvement to overall strengthen the supply planning. It's the people, processes, and technology, essentially. And with this greater visibility, you can improve the supply chain management and improve the different silos and bring them together. This has been really instrumental in the global family planning van, and a lot of lessons learned have come out of that for about a decade or so. And so now it's trying to take those lessons learned and apply it to vaccines for this broader global view of vaccines and what's happening in the world. So interesting things. In 4 countries, they tried to initiate this immunization ban. A lot of it's built on the same principles that we're doing with this CSP. Data visibility through streamlined tools in each country, building the capacity of the Ministry of Health to lead and do the analysis, and then establishing these routine review and analysis processes. Some of in these 4 countries, the success factors of all of them was this procedure for data review. So setting up this data review culture, the analysis of it and everything. The challenges, as we've noticed across a lot of these countries, the data availability, it was very donor dependent, and each country had their own tools, their data tools, so you couldn't take it to scale because there was no standardized way. Another interesting note, none of these 4 countries still have the VAN. That's a little side note. So yeah, great intentions, but might have fallen short. So what we're doing, so we take that to heart, right? Because what we're doing is we do want a longer term view of vaccines and supply planning for vaccines and more improved forecasting. So what we're doing with that, the country level political view and the political will to support this is a huge factor. And that's one of the main things that we've been focusing on with this forecasting initiative, is to make sure the governments are supportive, that they're involved, that they are leading the way. As I already mentioned, this proof of concept in these 16 countries is generating more interest at the global level. And so COVAX and Gavi, they're more interested in seeing how this could roll out. UNICEF is becoming more interested in looking and examining of their own ways of how they are doing forecasting. And if it's necessary to learn from the COVID example and the COVID work and apply it to routine vaccines, if there's a way to improve that. With the global support, there's more country will and stronger support from the ministries of health as well. It's a cyclical approach. The standardized tools and data facilitates the global forecasting. These standardized tools have been really important to get the right data, to get the right analysis, to get the right KPIs that all countries are looking at in a standardized way. And that's giving a stronger global view of what's happening with all the vaccines, because there's certain vaccines that are available, and now we're no longer constrained, but countries have to still be planning out what they need and when. And again, just to reinforce, with this VCSP, if it can get incorporated into routine immunization, that's going to make the whole approach more sustainable and government ownership, and then linking that to stronger routine immunization, incorporating COVID. And the expectation is that COVID vaccine will then be incorporated into routine immunization to strengthen the overall system. And one of the things I think we're seeing with the COVID vaccine rollout and with this initiative is using this and leveraging all the efforts towards COVID to then strengthen the overall routine immunization system and services. And that's all I have, because I talk fast. Questions? Questions? Anything? I can tell supply chain jokes if we need. Yes.
So how many years do you think we still need to disseminate all the COVID vaccines in order to fairly immunize the majority of the population?
Wow, that's a
Because
Question.
It's planning, yeah, because you are talking this forecasting and planning.
Yeah.
What horizon are we looking at for COVID?
Yeah. For those on the call, the question was how many years would it take to really to strengthen, to scale up the vaccination coverage rate essentially of the COVID vaccine and to get everyone vaccinated, right? And that's such a good question. We have seen a pretty impressive drop in demand right now through low and middle income countries. They assume largely because the COVID cases are lower, they've dropped, people are not dying, so there's not a lot of demand for the vaccines, which it's a very good question, because there's so many vaccines available now and so much money has gone to creating these vaccines and making them available. Now countries are saying they don't necessarily want them, and it's a balance of what's going to happen and how to continue to roll it out and to make sure the vaccines are available. But on the other side, you still need a lot of demand. This is like the softer side of immunization programs. You still need a lot of demand generation activities to encourage people to get vaccinated. The demand is dropping. It's questionable. Some people assume that the COVID vaccine will kind of become like the flu vaccine, that will have to change every so often to adapt to the variant, and it might become a routine every year type of thing. That remains to be seen. Yeah, I don't have a direct answer for you, so I'm hedging. But I do think it's still like, you've got to see the demand side of things as well for all vaccines. And there hasn't been enough push to encourage those who are hesitating to get the vaccine, particularly in low and middle income countries. There hasn't been enough effort to get the demand up in order for the supply to be, to max that out. Oh, thank you. Thank you. That's a great, Layla mentioned the measles and polio. What we've seen in the past year as well is a drop in other health services like other vaccines such as measles and polio, which are the two high cases right now. Polio is having a comeback in Africa right now, measles as well. The number of measles cases are going up as well. So it's a constant thing to always have that demand side and make sure the services are available. And the disruptions from COVID really worked a number on the other vaccine services, and it's dropped a little bit. So we are seeing cases of that. So that demand side, again, like the service delivery, it can't just, it's a constant thing, right? Like will always be there to have vaccines available and services available and support to people who don't actually have easy access to health facilities. Yes.
I was wondering how much of this groups are not judgmental, like around and how
the question was how much is this forecasting approach is judgmental, and then how much is more of the systematic. I would say majority is judgmental. I think it's all just kind of like, oh, this is what I think we need. Up to date, like the normal routine immunization is it's a very ad hoc approach, and it's systematic, but it's systematically based on what people think is needed as opposed to like actual numbers. And so that's one of the things we're trying to introduce here, is to have a more robust analysis based on evidence that's available up till now, to create a more systematic approach. But at this point, it's for the vaccines in general, it's based on outdated numbers, especially when you get to the resupply point within the country and how to distribute the vaccines from national down to the health facility. It's based on really inaccurate data, and a lot of stockouts happen. Yes. In terms of the forecasting, in terms of rollout and everything? So the question was how the countries vary within priorities and just implementation, I think, right? Each one is absolutely different, especially, and again, I'm focusing really on the low and middle income countries. Some places like Mozambique has probably 65, 70% of their coverage rate. So 70% of their adults have been vaccinated with both vaccines. There are other places like Nigeria, DRC that have just like a drop in the bucket and just, they're huge countries and just huge challenges. Yeah, you want to jump in? Yes, please.
Sorry, Wendy. Just wanted to say that with the standardizing the approach across all of the 16 countries that we're working with, and hopefully more, what we're able to do is feed that data into a platform that can look at them as an aggregate. And so right now we're using Tableau. We have the data sets from the consumption data, the shipment data, and the inventory levels all being fed into the Tableau. And then across the 16 countries, we can see what is the pattern of use, right? What is the months of stock that each of those countries have on average, and then following that month to month. So some of our monthly reports that we're actually sharing with the global partners at COVAX and Gavi is to show them what you can do when you standardize a process and you collect the same information, because then you can start having information on, well, everyone looks like their demand has dipped down, or the average demand has dipped down, rather than looking at the indicators that they're concerned, which again is coverage, right? We can see preferences for vaccines change and shift. We can see months of stock are starting to increase as demand is decreasing, which then jeopardizes the pattern of expirations that we will probably see in the future. And so that's been the wonderful factor of like, not only are we helping countries make evidence-based decisions, but then we're using their data to help global partners make better decisions too. And without that, we wouldn't be able, we'd have to look at it manually. You wouldn't